Hi everyone, I'm Dr. Tani Ping, consultant obstetrician and gynecologist, and it's again a 9 p.m. Sunday live video that I've been doing. So today our topic is regarding urine incontinence. I'll be focusing mainly on women, so it's urine incontinence in women. Okay, what is urine incontinence? I'm sure some of you at times may suddenly, oops, there's some urine that come out. Sometimes when you cough, and then oops, there is urine coming out, and only you know, no one else knows. Or when you sneeze and you see some urine coming out. Or there may be some of you who sometimes have to rush to the toilet, and before you reach the toilet, oops, urine came out. So this is urine incontinence, and urine incontinence is actually very common in women. So that is why we have a group of top gynecologists that we call them urogynecologists, which are gynecologists that specialize fully on urinary problems of women. So you see, you have urogynecologists. Why you need to have one group of gynecologists that only see all your urine problem is because urine incontinence is very common. Okay, so urine incontinence is very common among women, and many women actually just live with it. They never do anything, they never see doctor, they never do anything, they just live with it, and can actually affect some of women's life. I have seen women who wear pads to work every day of their life because they worry after their urine leak, so they just wear pad all the day of their life. So that is very sad. Okay, you shouldn't be wearing pad every day because of urine leak. I have also seen women who tell me that I have this urine problem, so I cannot go on holiday, I cannot go on a tour. You know how tour buses are, you know, when you go in a group of people in a tour bus, and then they have fixed time when you can go toilet, but they cannot control their urine. They need to go toilet more frequent, but they cannot just simply go toilet anytime they want because the bus is not going to stop for them. So as a result, many of these women just don't go holiday, no. You so sad, right? Okay, so sad, cannot go holiday because of urine problem. But actually this urine problem all can solve one. So that is why I have this video. I have this video because number one, many women have urine incontinence. Many women leak urine and they do not know where to go. They didn't even know it's gynae's problem. They don't even know that you're supposed to see a gynae for your urine leakage. And as a result, they live with it. They wear pad, they cannot go anywhere, and it's very sad. So it is one thing that a lot of women again live in silence. Actually, a lot of women live in silence, and they don't know where to go. Even for us, sometimes I don't know whether you remember when you're younger, you know, when you hug your mother or you hug your grandmother, and then you know your tummy will be very much lower down. You can actually smell some urine smell like that one among the older people those days. In fact, many women actually leak urine even those days, but they just live with it. It's sad, but they just live with it. But that is women those days. But I believe women today, most women do not want to live with these type of things. Okay, we are a much active group of women. We want to go everywhere. We want to do a lot of things. We have a lot of projects. Even when we are old, you know, we have a lot of projects. We have our own hobbies. We want to go holiday. We have a lot of things to do, and some of us still work until we are 60. So we do not want this urine leak to cause any problem to us. So if you want to know more about this urine leak, stay on to my live video. If you want to share with the rest of your friends, share now. Please share now. I'm sure many of your friends on Facebook have this problem, so you just share it. They're not going to tell you, hi, I have urine leak. Nobody share with people, and they feel shy to even tell anybody that you have urine leakage. So it's very important you just share the video so they get to watch it and they will know where to go. Because even last week I talked about painful sex. I have to thank many of you because you share it far and wide. A lot of women actually approached me in my PM regarding this problem, and some of them actually made an appointment to come and see me, because that is again another problem that a lot of women suffer in silence. So urine leak, it's also they suffer in silence, but not that bad. At least sometimes they may still share, but it's not something that's so private. But still, a lot of women with this problem do not tell anybody. Okay, so if you haven't shared, please share. Okay, so today we are going to talk about urine incontinence, which means that urine leak in women. Okay, so now I'm going to start already. So first of all, you need to understand what is urine leak. Urine leak is when the urine leak lor. So the first thing you need to know whether it's urine or not. Okay, this question also some women cannot answer me, you know. They say got fluid come out, but they do not know whether it's urine or not urine. That will be the first thing you need to determine whether it's urine or not urine, because we know, number one, you have fluid that come out from below, that wet your panties can either be urine or it can also be discharged. But of course the feeling is not the same lah. When your urine come out, it's from the urine hole, so you should be able to feel it's something like urinating. But if it's discharged, then it's coming out from your vagina, which is something like having menses, but it's not blood. You feel like fluid gushing out like having menses, but when you go and look into your panties, it's a clear color fluid. That one is due to discharge. Then if you do not know why you have discharge, then I have already covered vaginal discharge in women in one of my earlier videos. You can look for it, or if you find it very hard to browse through my Facebook, you can always go to my YouTube, where I download all my live videos in my YouTube channel. My YouTube channel is Dr. Tan City Clinic, so you can always still go back to my YouTube channel to see any of my older videos. Okay, so once you know it's a urine leak, then what is next? I want to know. Okay, you need to understand urine leak can happen at any time of your life. It can happen when you are younger or older, but we know that most women have urine leak only after childbirth. It's more common after childbirth, number one, and it's also common worsen as you grow older. So most of the time about menopause, around in your 40s, is when it worsens. So some people do not have any urine incontinence before they are 40, but once in the 40s, that's when they start to have, and it worsens slowly as they grow older. So you can either have urine incontinence even before you give birth, or you have urine incontinence only after you give birth, or during pregnancy. It has got to do with pregnancy, so you can have it during pregnancy or after you give birth. Or you can actually not have urine incontinence only in your 40s or later. Okay, so what are the types of urine incontinence? We usually say there are few types. The first one is the commonest one. Commonest one, we call it stress incontinence. Stress incontinence means you must do something before the urine leak. For example, you cough, then the urine come out. Oops, that is stress incontinence. You sneeze, achoo, and the urine come out. That's stress incontinence, because you stress it to come out. Or maybe you climb upstairs, climb downstairs, you run faster, you jump, the urine come out. That is stress urine incontinence, and this is quite troublesome to a lot of women, because not just sometimes they need to wear pads, because you don't know, you may cough anytime, you may sneeze anytime. They wear pads the whole day, every day of their life, because they scared that the urine will leak. Sometimes some women even cannot go for exercise. They want to go for their favorite exercise. All along before they give birth, they used to do a lot of very vigorous exercise. They jog, they jump, they do all kinds of vigorous exercise. And then after they give birth, they cannot do it, because every time they jump or they do a bit of strenuous exercise, and then the urine leak, and then they cannot exercise. So poor thing, right? The life has to change. But actually it's not supposed to be like that. There's things that you can do. So this is stress incontinence. Stress incontinence, because you stress it. You must have a certain stress, a pressure, because the urine come out. So this is stress incontinence. Second most common incontinence is, we say, urge incontinence. Urge incontinence are whereby you always feel like you want to go urine. You go to toilet, you come out, after a while you want to go toilet again. But not only that, sometimes if let's say the toilet is very far, or for some reason you cannot find a toilet, or some reason you're on a car, you're on a train, you're on a bus, and then there's no toilet, they need time to go reach the toilet. They need then maybe another 10 minutes because they reach the nearest toilet, and then before you can reach the toilet, your urine come out already. That is urge incontinence. So the thing about urge incontinence, number one, they must have urgency. They feel they want to pass urine, and many of these women, they actually pass urine very frequent. Like a while they go toilet, a while they go toilet. Another situation is they only leak when they feel like going to toilet, and they almost reach the toilet, or they cannot reach the toilet in time, then they leak. So that is urge incontinence. And some of women with urge incontinence, they actually have pain as well. They have all this pain over the bladder area, the place that the urine is kept. So that can be associated with urge incontinence. So urge incontinence is the second commonest, nothing to do with childbirth. Urge incontinence can happen any time of your life. It can happen when you are a teenager, in your 20s, in your 30s, in your 50s, in your 60s, in your 80s. Whatever age you are, you can also have urge incontinence. The third cause of incontinence, which are much rarer already, these things are very rare. What happens, we say overflow incontinence. So basically, what is happening is you have problem emptying all your urine. So you keep a lot of urine inside your bladder, keep until too much, then it overflow. So it's overflow incontinence. This one no need stress, if the urine just keep come out, keep come out, keep come out. So this one is very, very rare. And also there is a fourth type of incontinence where it's due to a hole. Some people after childbirth or after surgery or after certain diseases, they can actually have a hole, extra hole from the bladder out. So this urine, again, you cannot control. They just keep coming out, keep coming out, keep coming out. So I'm going to talk about this rarer incontinence first, so that it's just easy and you just bring it over. So this we call fistula, whereby there is a hole, there's an extra hole that urine is leaking. So these women, the bladder is always empty because the urine keep coming out. So this group of women usually can be either due to childbirth or due to surgery or due to cancer, certain illnesses like cancer. Why? Because if there is cancer around the uterus, around the bladder, sometimes the cancer can eat through the flesh and come out the other side, that causes the urine to leak. Or surgery, sometimes let's say if they have a surgery to either the bladder or the vagina or the uterus, and then in the midst of doing the surgery accidentally puncture through, and then somehow nobody noticed it, so after that the urine start to leak out. So that is one possibility, but it's also very rare. Another situation is childbirth. Childbirth can happen because sometimes, especially in very, very prolonged labor, where the baby is down there and compressing on the bladder outlet, and as a result of it compressing for many, many hours or many, many days, all the tissue around that area already die off. Then as a result, it creates a hole. And this is very common, not in Malaysia, very, very rare. We don't, even I have not seen it in Malaysia, but it's very, very common in countries whereby the hospital is not nearby. So what happens is these women, they try to go, they are in labor in wherever they are, but the hospital is probably have to walk there for 1 day, 2 days before they can reach the hospital. So usually it's like very, very poor country like Africa, Bangladesh, whereby women, if they cannot give birth, they have obstructed labor, and then they cannot have a cesarean also because there's no hospital near their place, so they have to walk 1 day, 2 days to reach to the nearest hospital before they can have a cesarean or forceps delivery to deliver the baby. And because of the compression of the baby's head at the pelvis for so many days, so that's why the tissues die off and the urine leak. And very sad, because we have to form a lot of camps for these women, because culturally these women will be cast off. Families don't want them, husbands don't want them, because urine keep coming out all the time, the floor is always wet, so nobody wants them, then they'll be divorced. And then very sad, this group of women. There are many, many camps in Africa, in Bangladesh, that is taking care of this group of women, whereby we repair all their wounds so that they can function normally again before we can return them back to the society. So this is the camps that the World Health Organizations have had in all these countries. So that's a very, very rare one. Then the other one is overflow incontinence. Overflow incontinence is usually due to some obstruction whereby the urine cannot come out, and as a result, too much urine, then it will start to leak. So usually got to do with certain nerve problem, either because of surgery or your spine injury that causes it to happen. But again, it is very, very rare. So the other two is very common, okay? The stress incontinence is very common. Urge incontinence is very common. So stress incontinence is when you sneeze or you cough and the urine leak. So what happens is all due to pelvic floor weakness. So pelvic floor weakness is more or less related to uterus prolapse that I mentioned in my earlier video on uterus prolapse. So pelvic floor weakness, let's say during pregnancy or childbirth, after you give birth, then after that the pelvic floor is injured. You know, you can have tear over the muscles of the pelvic floor that you do not see with your eyes at all. So all this injury can actually cause the pelvic floor to weaken. So pelvic floor weaken, we say there are 3 compartments: the front compartment, the middle compartment, the back compartment. So in the middle compartment, if it's weakened, that's when you get prolapse. But if the front compartment is weakened, that is when you get urine incontinence. So you can get urine incontinence even during the pregnancy itself. Some women, even the first pregnancy, towards the end, they actually get this urine incontinence, stress incontinence in the early part of the pregnancy, late part of the pregnancy, due to the baby compressing of the bladder. But at the same time, it's also because their pelvic floor is weak. Then after childbirth, the pelvic floor can be even weakened due to certain injury and also due to the outstretch of the pelvic floor. So that's why they can get this weakening of the pelvic floor around the front compartment of the pelvic floor, and as a result they get this urine incontinence. And pelvic floor also weaken towards menopause and as you grow older. So these women, whatever it is they have when they're younger, in their 40s, nearing to menopause, it just worsen and worsen and worsen as they grow older. So this stress incontinence, what do we do? What can we do? So simple. First, you need to do Kegel exercise. You need to do pelvic floor exercise. So this is something that I routinely teach my mothers in my antenatal classes. So we teach all our mothers how to do Kegel exercise. It's very important to do it. Or any women in my clinic who tell me they have stress incontinence during pregnancy, I will also immediately send her to my physiotherapist to learn how to do proper Kegel exercise. And if done properly, most of these women improve within the week. If you do a good Kegel exercise, you should have this problem solved within 1 week. So that's what I usually do. Then after childbirth, what I do is I will usually have a pelvic scan, perineal scan, pelvic floor ultrasound for their postnatal checkup. So pelvic floor ultrasound, we already can see how the bladder, where's the bladder, has it come down, do they have funneling? Funneling means, you see, this is the passage, the tube, I mean the outlet of the bladder. So but if it opens up like that already, we know that it's weakened already. So when you have funneling, then we need to also teach all these women how to do Kegel exercise. So when we see women, either they're symptomatic, they can tell me. Some people after giving birth at the postnatal checkup, they will tell me already, doctor, during my after delivery I have problem controlling my urine. So if they tell me that, or if when I do a pelvic scan, because sometimes they don't tell me that, maybe they never cough, they never sneeze. So and also after confinement, you're not really that active yet, you don't run, you don't jump. So some of them, they don't realize, but when we scan pelvic floor weakness, we see funneling, I will immediately ask them to see my physiotherapist, so to teach them how to do the Kegel exercise. Okay, we can actually, if you look at YouTube and anywhere, they do teach Kegel exercise, but nothing is like a physiotherapist teaching you how to do, because they don't just explain to you how to do, they will actually look at you and make sure you're doing it properly. So they may even ask you to remove your pants, and then they will look at how you do and whether you do it properly. So you need a physiotherapist that specializes in women's health. That is the best people to go to, where they specializes in all this pelvic floor, and they're very good at it. Within a week, I see many of they already can control their urine. And of course, as you grow older, it will worsen. Let's say one day, whatever you do, your Kegel exercise, whatever you do, is not improving anymore. It will reach a stage, especially when you're much older. If you're much older, then sometimes exercise may not help anymore, partly so because you are probably weaker, more difficult to do exercise. But obviously, Kegel exercise can do up to a very aggressive level, because you must understand, it's an exercise where we build the muscle, we want to strengthen the muscle, we want to build muscle power. It's like same like people who develop muscle, like for example, you want to develop this muscle. So if you carry weights, let's say today you carry 1 kilo, tomorrow you carry 2 kilo, next day you carry 5 kilo, then after you carry 10 kilo, of course the muscle will increase, right? So same with stress incontinence. So when you do Kegel exercise, initially you just need to learn how to do it properly. But after time, you can actually increase the intensity. There are 2 ways of looking at how you increase the intensity. Number 1, you can buy a biofeedback machine. So you have all these urine incontinence biofeedback machine where it has a probe. It has a probe where you put inside your vagina, and then you squeeze. And then as you squeeze, you can see how strong is your squeeze. They actually measure for you. So when you have this, you know how strong you need to squeeze. So you squeeze harder, you relax, you squeeze harder, you relax. And then you can give yourself a target, like today I squeeze until 5 enough, tomorrow I must squeeze until level 10, you know. So you slowly increase your level, and of course the muscle becomes stronger. And as any muscles in this world, if you stop exercise, it will weaken back, right? Like today you take 10 kg, and then one day you stop doing it, and after a few more months, of course, this muscle will gone. So same thing. So your pelvic floor is also the same. You cannot stop doing the exercise one. You need to do for as long as possible, especially if you already have incontinence. So if you keep doing, then of course it will improve. Another way, if you do not want to buy the machine can be quite expensive, and usually it's imported because we have to buy from overseas. Another thing we can do is they do sell weights as well for the vagina. Also saying normally I ask women to buy from online, but the thing now is it's a lot cheaper because it's just a weight. So you can put it inside and you hold it and make sure it doesn't drop. So today you hold that thing is smaller, lighter, and it doesn't drop. And then you want to upgrade, you use a heavier one. As long as you can keep that thing inside and it doesn't drop, that's how you increase the muscle strength of your vagina. These are some of the ways, although we feel that the biofeedback is probably better. Okay, so that is if you train your Kegel. Okay, let's say you reach an age that you cannot train anymore for some reason, or as you grow older, it's not so easy to build muscle compared to when you are young. So what happens is you have the second alternative, which is surgery. We always leave surgery last. So what happens in surgery is very simple. I always tell women it's very simple. Down there, I make a small cut, put in the ribbon, I tighten it, and then that's it. The wound is only about 1 centimeter, very, very tiny little wound. After this, I do this, you can go back on the same day, and then and you can pass urine like normal, you don't need to worry. Life goes on as usual the next day. So it's a very, very tiny surgery that you can do it very, very easily. And only thing, it has one problem, because we know that the pelvic floor weakens with age. As I earlier mentioned, the older you get, the weaker it is. So this procedure to tighten your urine tract does not tighten for the rest of your life, because it weakens with age. So today I tighten to a certain level. I cannot tighten until you cannot pass urine, right? So I have to find somewhere in between where it's not too tight, it's not too loose, so it's somewhere there. So that you can still pass urine like normal. So I will tighten it to a certain level, and then we will let you go on, and as you grow older, as it loosens, it may come back. And then what happens is then we may need to do a second time, or you can put a second ribbon and tighten it again, which is not a problem. So usually I say it can last usually between 10 to 20 years. Most women who do this surgery can last from 10 to 20 years without a second surgery. So it depends on how old you do lor. That's why I don't normally advise women to do it when they're too young. So when you're young, I always say go and see physiotherapists exercise. You're young lah, exercise lah. Okay, but if you're like in your 50s, 60s, if they want to do, I think it's fine lah. So 10, 20 years, they're 70, 80, it's still okay. If they really still so active when they're 70, 80, then you want to do a second one also can, because this surgery is so simple. No need general anesthesia also can, no need to stay overnight in the hospital also can. We can just inject some local anesthetic, just like you know when you go to see a dentist, they just jab here. So I can also jab down there, just jab there, and then just put in the sling, and then you can go home. So it is very low risk surgery even for very old ladies, so no problem. So normally that's what is going to happen lah. Most probably I say around your 50s or 60s, if you put, it's fine. Not when you're very young. But if you want to put like in your 40s, but just remember like it can only last you 10 to 20 years. We may need to repeat again in 20 years time. So that is urine incontinence for stress incontinence. So that's stress incontinence. So another one is urge incontinence. Urge incontinence is a different thing. Now you feel like you keep want to go to toilet. So if you have to go, if you don't go, it will leak out. So this is urge incontinence. Urge incontinence is a different ball game altogether. It's not due to pelvic floor, it's all due to your bladder cannot keep so much urine. It cannot keep so much urine. It reaches a certain stage, it has to release the urine. You see, when we have urine until a certain stage, then we will feel we want to pass urine. And then what will happen is the bladder will contract. It will contract to squeeze to pass the urine out. So what happens is that these women with urge incontinence, the bladder capacity has shrunk to a smaller capacity. So when it reaches that amount of urine, the bladder will want to squeeze it out. So because you want to squeeze the urine out, you will feel like you have to pass urine already, and then you have to pass urine. And then if you don't pass because it's squeezing, and if you don't open it to let it pass, it's going to be very painful. That's why they tend to have pain as well. Because your body is fighting each other. The bladder is squeezing, but the passage don't want to open. You know, when you squeeze, it has to open. So you can cause a lot of pain as well. But sometimes because your pelvic floor or your passage you may not be able to hold it so long, so eventually you will release it. Because automatically in most time when we pass urine is when the bladder squeeze, we release. So that is what's going to happen. So urge incontinence is a much difficult incontinence to deal with because it's due to many reasons, and there are many things we need to do. It's not like just Kegel and that's it. Oh no. So these people in the first place, again we will teach them Kegel lah. Because if your bladder squeeze, if you can hold tighter, of course hopefully you can reach hold longer lor. So if your pelvic floor is not so strong, of course you will release and you will. But if you can hold longer, hold harder, hopefully it can help you to hold until you reach the toilet. So first thing, of course, we will also teach you Kegel lah. But more important is not that. We have to train the bladder. So in urge incontinence is training of the bladder, number one, to be able to hold more. Slowly we increase back the bladder capacity. And this thing, who teach again? Who teach? Physiotherapists. So it's again the physiotherapists. You need to look for physiotherapists that is specialized in women's health, because these physiotherapists, and they're usually women, so they are very specialized in dealing with all these women problems like incontinence and prolapse. So they will train you to retrain your bladder back. And last of all, we will usually also go for a stress assessment. Why stress assessment? Okay, I need to tell you that urine incontinence due to urge very often is also stress related. A lot of women can tell you this one. They'll tell you that after something happened, that's when they started having it, and they have it for many years. Like for me, I also had urge incontinence before, long ago when I was in UC. I think medical school was very stressful for me. Okay, so when I'm in UC, I was very stressed, so that is why I used to have urge incontinence when I was in UC. But the moment I started working, gone, no more already. So then I don't need to have this problem anymore. And I understand that it's all due to stress. So when women come to me for urge incontinence, I don't just treat them for their bladder retraining, see physiotherapists. I also make sure they go and see my therapist as well, my therapist, psychotherapist. So they need to see my counselor to look at their stress, to understand the stress that they're having and what are the stresses that make them have this urgency. And last of all, of course, got medication, got medicine one. Actually, this urge incontinence got medicine one, but this medicine have a lot of side effects. They tend to make you thirsty. So a lot of women don't like it, because women who keep having this problem, right? They keep going to toilet, so they don't like to take medicine that make them thirsty and then keep going to toilet again. So a lot of resistance in getting women to take this medicine. And one person I know is actually my own grandmother. I still remember my grandmother has urge incontinence when she was in her old age, in her 70s, and she had to wear a pampers. Because old that's why when urge incontinence, when you're old, you end up wearing pampers one. Why? Because when you're old, you cannot rush to toilet. When you go toilet, right, you need time to slowly get up and walk until you reach the toilet. So before you reach the toilet, you're going to pass urine already, because your pelvic floor is so big already when you're old. So you cannot control, then you're going to pass all the urine. So that's why a lot of old women, actually you see them, they actually wear pampers. The reason why they wear pampers is because they have urge incontinence. That's why I always tell women, urge incontinence, you must settle before you grow old. Because by the time you grow old, you cannot go toilet already, then you have to wear pampers. I'm sure none of us as women want to wear pampers when we are old. Okay, although we see our grandmothers wearing pampers, but we don't want. So actually, it's this urge incontinence, we must try to solve it. And I still remember the doctor gave my grandmother medicine. She refused to eat one. She got so many medicine, she got high blood pressure medicine, heart disease medicine, she got so many medicine, and yet she it's that one pill that made her go toilet all the time. Sorry, it's that one pill that made her thirsty all the time. She knows the pill that made her thirsty, and as a result, she doesn't want to take that pill. She just refused, because she said, this pill makes me thirsty. She may be senile, but she knows that pill makes her thirsty. So she doesn't want to take that medicine because it makes her thirsty. When she's thirsty, she keep wanting to go to toilet. So she doesn't want that. So that medicine, even though it helps, but we also know it's not 100%. It only reduces. So it reduces certain capacity. So for me, I give this medicine if my patient want the medicine, but I also usually tell them, you take this medicine as a temporary measure, okay, so to help you go through your day-to-day for now. But you still need to see my physiotherapist. You still need to see my counselor. As a team, we will work together to help you. So my counselor will reduce your stress, find the real reason why you're stressed. Every stress related symptoms that a person has is related to a certain stress. So the counselor first have to find the root cause of your stress that is related to your urine problem. So once they find the root cause of your stress, then only they can help you to solve this problem, and you also can only solve this problem after you know the root cause of your stress. And then the physiotherapist train your bladder again to make your bladder capacity bigger. And this one, of course, with medicine it helps her better lah. They usually can do this job better, and then slowly as you are better with your bladder capacity, then we slowly reduce the medicine. Or some women just don't want to take medicine, also can. You just make sure you go and see physiotherapist and counselor both together. This problem will solve one. So this problem can solve one because it's very stress related. Actually, most of women with urge incontinence knows that. They will know when during certain time when the office is very stressful, they have difficulty controlling your urine. So this is something you need to do something about, because why? As I told you, if you don't solve this problem until you grow older, you're going to wear pampers, okay? So if you don't want to wear pampers, please solve it. Because you may think that, okay, it's my job stress that caused me this problem. But if I don't solve your problem today, when you grow old, you got other stress ma. Old people also got stress one. They got stress about whether the children is a failure to them, whether the son come back and see them, whether the children come home. All these are old people's stress. And they are also stressed. Trust me, they are also stressed. So these stresses also cause all these old people to cannot hold their urine, and as a result, many of them actually wear pampers. If old people are not stressed, then why so many old ladies are wearing pampers? They are also very stressed. So we do not want you to have this. You must start to train your bladder. Retraining, we call bladder retraining. So these are the common causes of urine incontinence. So if you have any question, you can ask. Okay, you can ask and try and answer. I wonder whether there's any questions so far. I will now look into my other phone. So urine incontinence is very much also linked to uterine prolapse. So if you want to know more, because a lot of people, especially when you have stress incontinence, you may also have uterus prolapse. So if you want to know more also, you can look at my older video on uterus prolapse. And uterus prolapse video, you can either browse through my Facebook or you can go to my YouTube channel. My YouTube channel is Dr. Tan City Clinic. So you go to my YouTube channel, also you will be able to find the video on uterus prolapse. Then you can see it, you can get more knowledge, and as a result you can use both of the knowledge you gain. And let's see some of the question. Okay, this Lim Kaisia say, if after urinate but still feel like it's unfinished, what can we do? If you feel that it's unfinished, there is two possibilities. Number one, we still want to see whether it's prolapse, because sometimes what you can have is you have prolapse of your bladder. When your bladder prolapse, it's actually very difficult to empty the urine one. So really, when you prolapse the bladder, you can't empty your urine. What happens is that let's say this is your urine outlet and this is your bladder. So this bladder is situated like this, so when it contracts, all the urine comes through. But sometimes when you have prolapse, the bladder actually go down here already. So your bladder is down here, so when it contract, there is still urine accumulated there. So it's still got to do with prolapse. So in this type of situation, what you need to do is you need to do Kegel exercise. You need to find someone expert in Kegel exercise. Lim Kaisia, I know you come to my clinic, so you can always just see my physiotherapist, and she can guide you with this Kegel exercise to help you to do that, so that you can bring up your bladder again. So it's part and parcel of uterus prolapse. So this one very often due to childbirth as well. Okay, but another way is also some people with urge incontinence also feel that, because even after they pass urine, they feel there's always urine, but actually what they feel is the urge only, not necessarily got urine. So that one is also possible. But if it happens after childbirth, then I would think about prolapse. Okay, she asked what about opposite condition. So her bladder is full of urine, but she can hold it for very, very, very long time and don't feel like having any urge to go toilet at all. I don't think that is really a problem, because I don't think you have reached your bladder capacity lah. So all of us have a capacity one, and then urine capacity can actually be very, very high. It's not a problem as long as at the end you pass urine, you can empty it, and that's fine. Okay, but if you don't feel like passing urine, and after that when you pass also you cannot pass out all the urine, and then that will be the third cause of urine problem that I mentioned, which can cause overflow incontinence. But most people you can hold a lot of urine, but at the end when you pass, you can still finish it. That's fine, okay?